Good afternoon. I am presenting the case of living larvae wandering in the eye, a rare case of ophthalmomyces externa. What is known? Ophthalmomyces is the infestation of a dead or devitalized tissue of human or animal with fly larvae. These are generally found in the poor, neglected old person and with the lack of hygiene and with poor health. What is not known? A living larvae infesting normal vital eye in a young, healthy adult without any comorbidity and without close contact with animal. About the patient, our patient is a 20-year-old apparently healthy male presented to the outpatient department of the AIIMS Bhopal with the chief complaint of foreign body sensation and excessive watering of the right eye since 3 days. History of present illness: there is a history of dust falling in his eyes while riding motorbike 3 days back. No other significant ocular history and no other history of contact with animal. There are also no pain during extraocular movement, no loss of vision and no orbital inflammation, thus showing there is no orbital involvement. On ocular examination, vision of the both eye is 6/6. Extraocular movement is normal and lid and adnexa are also normal. The conjunctiva of involved eye is mildly congested, and there in superior temporal fornix a wandering microbe with rapid vermiform movement seen with 1:2 dimension, white in color with speckled pigmentation. There are a few petechial hemorrhage also seen. The cornea and the pupil within normal limit and posterior segment examination was also normal limit. This is the slit lamp examination of that patient of involved eye with congested conjunctiva, and there is a microbe with rapid vermiform movement in the superior fornix with few petechial hemorrhage. Microbe was removed under topical anesthesia under slit lamp and sent for the microbiological examination. And further exploration under microscope, 2 more wriggling microscope were removed. And this is the wriggling dance of the larvae in the superior conjunctival fornix. The worm tried to move away from the bright light, and there is another worm which also trying to move from bright light and going to the fornix, and another worm is on the cornea. All these are removed on the topical medication and then sent for microbiological examination and identified as the first stage larva of Estrus ovis, which is also known as the sheep nasal boat fly. Management done by topical povidone iodine drop with ofloxacin and lotiprate eye drops. Oral ivermectin given 1000 mg as a single dose. In this duration, 3 more larvae was removed. Patient was kept on the same treatment for further 2 weeks. Patient was symptomatically better with visual acuity 6/6 in involved eye. Patient was kept on follow-up with which was uneventful. Do not forget, larvae shows negative phototaxics. They may be missed on slit lamp as they hide in fornices away from the light. Crucial to remove the larvae gently to avoid causing any damage to underlying structure because they are strong adhesion to soft tissues by body spicules and the mouth hooks. Non-specific signs and symptoms entail a high probability to misdiagnose the case as acute conjunctivitis or episcleritis. In such scenario, larvae can potentially invade the deeper tissues and can cause significant inflammation, tissue damage, and secondary infection. Even though the patient may experience immediate relief, it is essential to have follow-up examination within the 24 to 48 hours to ensure that any remaining larvae in the conjunctival sac are treated or removed. This was seen in our case also when the larvae were removed on 3 subsequent occasions after the initial diagnosis. If any larvae are left behind, the initial treatment may not be effective. Despite the infestation into ocular tissues and inflammatory potential, most of cases are completely cured. Though a simple case, but worth your attention. Take home message. Not all red eyes are conjunctivitis or scleritis. Trauma with organic vegetative matter, even trivial, should be evaluated for any microbes, particularly ophthalmomyces. Careful slit lamp examination and though thorough wash of fornices with sterile normal saline after double eversion of lids is mandatory. These are my references, and thank you.
Yeah, this case is actually exactly similar to one of the cases which I recently saw in OPD. It also had about a 14-year-old boy. He was driving his moped, bike, and though without license and all, and got this about 20 to 25 larvae and continuously I removed it for 3 days, and as soon as light is shown, this larvae, they move very fast, so it's very difficult to remove them. So ivermectin dose was given, a single dose, I think it is sufficient, and then it can be repeated also, some people say. And the child also had 14 years, he had a vasovagal syncope while removal on slit lamp. So he fell down, then some time later he vomited, so all these episodes happened. So yeah, this is a ship bought only, then I went and I searched the literature. Yeah, so interesting case. Thank you.
Very good, and I just will comment that eye people, like eye surgeons, people will like see something like this, seeing vasovagal or something. Recently I operated a lady and she came for examination, and then while examining her eyes like this, sitting on a bench, she went like this and fell down, death, but she did not die. So God knows, I am so scared of I feel like examination also, do you need anesthetist to examine someone? So they fall down like that. Another thing about that, every red eye is not conjunctivitis and scleritis. If there is no speaker, I will say my experience of one foreign body, one kind of I was in, Safdarjung Hospital, eye department. One lady came with red eye, nasal. So just saw and Manica conjunctivitis. Antibiotics, steroids, but it won't go away. Repeat examination, no history of any kind, she would not give anything at all. So one day just I started palpating here and I found a sharp thing. That Manica, red eye is because of this foreign body, but what it is? Then we did the CT and this was a long knife from here, came from sinus, and saved the orbit wall के पास जाके वो nose में था, मतलब यहाँ आ गया था, nasal side of the orbit, and it was a stab wound, knife broke, it was nearly 4-inch long knife, and it was done by this lady, her son did it. Her son stabbed her mother because he wanted money for liquor. So liquor should be banned in Bihar and everywhere you have banned. So banning means death, so more early moksha. You can go up, meet with the God and be happy. There they have the better drinks, I think somras and all that. So why to be on this land, which you have so many attackers and so many people? There are all good people. No?